Thank you, everyone, for being here. I'm really excited to introduce William Boehringer, our new physician assistant. He's not new to me. I've known him for 11 years now,
Yeah,
11 or 12 years. We initially worked together at Atrium Hospital, the main Atrium Hospital, as an inpatient neurology team. So we just lived and worked in the hospital. Well, we lived outside.
Yeah, a little bit outside.
We had a home outside the hospital, but we worked in the hospital together every day and on call at night in some of the most intense neurologic settings, like the intensive care unit. We were involved in responding for people having acute strokes that would come into the hospital. We've been on the helipad waiting for helicopters to come in at night, wondering where they were to bring our patients in who were having strokes. So we know each other very well, and I came to respect William as a physician assistant. His training and his years of experience made him very well suited to coming over to our practice. So we were surprised when he answered our help wanted ad. I was delighted. And I guess it may not have been fair to the other applicants because we immediately brought you to the head of the line and brought him in. So William has been with us in the practice for about 7 weeks now, roughly.
Yeah,
7 weeks.
Yeah.
So he's been new to the specialty of memory care, that's where he's concentrating his work, not new to the actual conditions. But he's been, I guess his learning curve wasn't as steep as it might have been because of his experience. So he's caught on very quickly, and he is seeing individuals in our practice already. And we've been very, very happy with that. So I thought it would be important for people to understand the role of the physician assistant, because I think sometimes it's sort of unknown relative to what the role of a physician is. And maybe we can get started, William, by helping everyone know your training, your backgrounds, and details around that.
Sure. So, hi, my name is William Boehringer. Lucky to have Dr. Chaconas here with me. As he said, we've been knowing each other for a long time. I started in medical area back in 1998, where I was a CNA when I was going through school. Kind of went from a CNA to a monitor tech to a phlebotomist. And while I was working my way through school, I got my bachelor's degree in medical technology, where I worked in the laboratory. So my wife went to nurse anesthesia school, so I was working in the blood bank at Wake Forest and Winston-Salem. And then we moved to Colorado together, and then I went back to school to pick up a physician assistant, and I've been working as a physician assistant now for probably 15 years, 16 years. I've started off in dermatology, worked there for about 3 years, and then I went into working in the emergency room as well as neurology with Dr. Chaconas back in 2013. So I was doing 2 jobs for quite a while. I was trying to pay off my loans and that kind of thing. But I really enjoyed neurology, and I became full time with them. Was doing kind of PRN work with the ER, and in 2021, maybe a little bit before that, I was getting older, so the hours of working days, and then kind of swapping nights and back and forth, was kind of catching up to me a little bit. So I wanted to stay within neurology because I enjoyed it. So I was kind of looking, seeing where I could kind of, fit in, what would be the best fit for me. And I happened to be on Indeed, and I saw the job opening here at Memory and Movement, and I just automatically applied. And then when I had my interview with Janet, and then I came and had the on-site interview with everybody. I saw Dr. Chaconas, and then I also know Dr. Iyer, who's one of our physicians here. and then just learned about the practice and how the model of the practice works, I knew it was going to be a perfect fit for me. And when I left from the interview, I was on my way home, and I was like, I hope I get it, because I really loved the idea of how we are able to see patients, the time we're able to give, the way that we're able to handle, take care of caregivers and the patients. So I was very excited about it, and I was lucky enough to be, accepted. So that's kind of a general, kind of short way of it's kind of going through my history. But all started in '98 with being a PA in mind the whole time, just kind of working through the process of getting to where I wanted to be.
And, you gave me a sort of a recollection when I came to interview at this practice myself. Our founding physician, Dr. Chuck Edwards, said, I remember seeing you in the hospital, and you reminded me of that monk, that famous picture of the monk during Vietnam. He's in Saigon, and he's lighting himself on fire. I don't know if you'll remember that classic photograph, but he said, I thought you were lighting yourself on fire, so I'm glad you're in our clinic, because we put fires out here. And I said, okay, this sounds like my cup of tea. Yeah. So you alluded to the time and attention model that we provide for care here. We try not to rush through anything. And it's so important that we spend the time with the families and our patients. And the other reason I'm so glad you answered the help wanted ad is your temperament. I'm a lot older than you, William, but you do have some maturity, and that's really important to us. And as we're talking about the role of physician assistant or nurse practitioner, we have nurse practitioners as well, working in the care team with the physician and our nursing staff. If anyone listening to us is not being seen by us, this model is duplicated throughout the clinic. And we're sticklers on making sure the level of care, no matter which care team you all are seeing, is replicated all throughout. So we've been very picky on who we've been hiring.
Yeah.
So I feel lucky to have you.
Yeah.
But maybe you could help the audience know the training. Some people wonder, is it an undergrad degree? Is it baccalaureate, postgrad? What does it take to become a physician assistant?
Sure. So when there's several criteria to be able to even apply to a physician assistant program. So my training, the reason I started in medicine was because I wanted to take care of people. But the other reason was to gain medical experience, because physician assistant programs, that's one of their criteria before you can apply. So I getting a bachelor's degree in medical technology, and then working in the laboratory for about 6 or 7 years after that, and then all the additional experience I had prior to that gave me all the experience that I needed to fulfill the requirements for that requirement. And then another requirement for PA school is to shadow a physician, shadow PAs, to make, they want to make sure that this is something that we really are dedicated in doing or want to do. And then, of course, then it's how did you do in school, and then you take a GRE, kind of postgraduate test to make sure that we're able to get through the program. So the PA program itself is based on the medical model, just like it is for physicians.
That's cool.
Now I'm not a physician, of course. I didn't go through all the training that a physician goes through, but we went through the same kind of model that a physician goes through. Meaning, there in the very beginning. So we have a 2.5 year program. And the first year was all dedicated on didactics. So we would go through pharmacy and pathophysiology and all the different areas of medicine, anatomy. And then after that year was complete, then we would go out into the field out and do our clinical work, which is kind of our residency. So we would do rotations in primary care, internal medicine, pediatrics, surgery, OBGYN. I did a elective rotation in neurology because that was an interest of mine back then. And I also did a elective in cardiology. And then after that, we have to take a national board exam to be able to practice. And then, of course, in any state that you're in, you have to have a state license as well. So I have a state license in North Carolina and then a national board license that we have to have to practice.
What I've been impressed by with the evolution of physician assistants, I remember when they were most utilized for procedures, like in a surgical setting, in some of the communities where I practice. Then I saw them blossom into primary care and all the subspecialties. I know that cardiology has been very attractive across all of medicine, and physician assistants have been drawn to that specialty, for example, and all the complexities of that, including the medications that cardiologists are entrusted in managing. So there's been so much growth in the physician assistant world and more schools. There's been so much demand on providing care. We're a growing population, we're an aging population. To expect physicians and specialists like neurologists to be able to cover that demand was never reasonable. Whether or not we think there are enough doctors being produced, that's another debate. Neurology, interestingly, I don't know why this is, because I was immediately drawn to it, and I know you were before. A lot of physicians they're not drawn to neurology. I like to think because they don't have the aptitude. It's so complicated, but they're drawn to other things, surgical specialties, primary care. But neurology is very specific to a certain personality type, and I find that it's people who are generally calm and generally analytical about things and patient. And we require that in our practice, and you certainly fit the bill. And, all the work we did together in the hospital, we did encounter quite a few people through the years who ended up having dementia, whether that was the reason they came to the hospital because of sudden confusion and maybe no one never knew they were getting dementia, or they had it and they came into the hospital for other reasons. And we had to be consulted together to see them to manage the dementia while they're being cared for something like pneumonia, for example. So you've had exposure to dementia through your career. Now you really have focused on it coming in here. And I'm asking you for the first time, I guess it's been almost 2 months, how have you found it to be in regards to specializing to this degree in memory disorders?
Yeah, so when I first came out, even before I started, after I realized, after I was hired, I started doing, some research and reading up on memory. We did get a bit of memory education, of course, in school, but I wanted to make sure that I was up to date on all the new medicines and treatments and testing that was available, because it's changed quite a bit since I graduated. So that started before I actually started working, and then when I started working, Dr. Chaconas was kind enough to get some books on memory that have been very helpful.
So loaded you up.
Yes. Yeah.
Textbooks about this thing. Like, here, read this.
read all of it. So I've been reading that and learning a lot. And really what I've learned the most, or where I've learned the most, is the orientation time that I've had, spending it with Dr. Chaconas and some of our other memory providers, even some of the other APPs, just kind of learning what tests they like to order and when they order them and why. in what situations. And then I kind of had a head start on determining, so dementia is kind of a generalized umbrella term, and working with Dr. Chaconas in the inpatient setting, if anybody was confused, there was you'd have to go through a process and develop a differential of what could be causing this. And that kind of goes back to what you were saying about us seeing some patients in the hospital who had dementia, who or was undiagnosed at the time. But what I find really helpful here and a lot of fun for me, because I enjoy the interaction with patients, is just listening to the patient, listening to the family members, and gathering the information without interrupting with a whole bunch of questions from me, so that I can understand what's going on, how you're feeling, what you're experiencing. And it allows me to work through that differential in my mind as to what might be going on, which leads to me ordering the proper tests, or at least getting a sense of which test I should start with, to start figuring out kind of what the main driver of the memory complaint is. And then, I have Dr. Chaconas, so we work closely together. And when I see patients, I at times will just go into his office and run things by him. And I've done that all through my practice as a PA, no matter where I was. When I worked in the ER, I was right out of dermatology, so that was a steep learning curve. But I approached it the same way. I would see patients and I had a lot of questions in the very beginning. But as I got more experience, then I had less and less and became more independent. And that's kind of the process that I'm going through here.
I know you remind me of myself eight plus years ago when I first came here. There is a shift because, as many of you have learned, our model for care really pays attention to diagnostic precision on behalf of our patients, proper management of the condition, trying to find all avenues of care, whether it's pharmacotherapy or research opportunities. But we also focus on the family members who are involved in caregiving. That's a big shift. I think pediatricians are used to having the families with the patients, but doctors who care for adults generally are seeing them privately without family members. That may be not so true in the hospital where people are ill and their advocates have come in. They're usually family members. But when you came here, you had to shift gears because you're also counseling family members as well, and relying on family members for important historical facts to help us care for our patients. And I'll say this for the first time, I've been impressed by your, if anything, you are amazingly polite and attentive. You're kind of old world in that regard, which I really like. And our patients tend to be seniors, and I think they should expect that level of respect, and you naturally deliver it. Your competence has been great. So when we've discussed patients and you tell me what your plan is, more often than not, it's exactly what I would have done. Mm-hmm. And I'm not surprised by that because we worked together for so long and you are experienced. Yeah, thank you. So I know it was sort of an untested situation when you came here, because one of the questions was, how were you drawn to the care of folks with memory disorders? I think it was, well, there's that help wanted ad. Let me see what they're doing. Yeah. And you were very attracted to it, which I very much appreciate. And then what you're alluding to is you rotated, well, you've been rotating for 2 months now. You're seeing patients on your own, but you rotated side by side with me and some of the other doctors to see how we do things and to get your feet wet and get your comfort level. Yeah. But you're not wet behind the ears. You're not fresh out of school. You're a veteran, and it's been seamless, and I've been very happy with that. Yeah, it's been a pleasure. When I first kind of graduated from PA school, I had this idea in my mind of what
kind of care I'd be allowed to give. And this model that we have here is what I want, what I imagined. A lot of the areas that I went into was not so much the case, but I did everything in my power to make sure that the patients were heard and listened to, taken seriously, and the family was present, that they were able to talk. And then, my job was to, again, kind of figure out what's going on based on information given to me. And then, when I see patients and we finish the discussion and we come to the point where we're trying to figure out what to do next, it's really a group kind of discussion. Like, I'm not the one just kind of telling patients what's going to be done. It's a decision that's made by myself, the patient, and the family members, and that's been really gratifying here because we have the time to do that, and we have a process with our nurses, our support staff, where I'm speaking to maybe the family members, and the nurse is taking care of a portion of where the exam portion, gathering information that I need while I'm talking to the family. Then I can move and go talk to the patient, and then the nurse can go and kind of gather some more information from the family, and then we come all back together again. And then the bulk of the visit is all spent really kind of discussing what we've done, what we believe is going on, what my recommendations are, and then us as, provider and then patient caregivers decide what the next best steps are and what you are okay with. We don't force anything on anybody. It's just we want to give you our best recommendations, and then why that's a good recommendation, and then have you also make the decision with us. So that part of this practice has been significantly gratifying to me, because it was harder in working fast pace neurology inpatient, and especially ER work, and but yeah, so that was my main reason for when I saw the opening. Kind of, I was like, I had an idea of what the practice had available, but I didn't really know the model and things. So that was why I was really excited to be on board.
And again, you're sort of reminding myself, when I came here 8 years ago, the concentrated care of folks with memory disorders has evolved significantly in the past 8 years that I've been here, including available treatments and just the testing alone. So I like what William is saying about a customized approach, because we could throw the book at everyone and have them inconvenienced by many tests, some that take hours to do. And what we try to do is be efficient and base everything on the history. And we get that from our patients to the degree they can give us that history. And that's supplemented, most importantly, by the family members. And then we can figure out what makes the most sense testing-wise to get to a precise diagnosis, rather than what's called the shotgun approach, where we could order 6 standard tests on everyone and see what drops in our lap. That's not fair. That's not cost-effective, and it's inefficient. And many times, if you do too many tests, you'll be delivered abnormalities that are not abnormalities, and now you have to fuss over those, and everyone's worried, and what does that mean? And then all of a sudden there's all this smokescreen that's risen up, and it's getting in the way, because we know how busy everyone is. Caregiving certainly takes a lot of energy. We don't relish overwhelming anybody, but we want to be precise and efficient and effective. And I feel this model that we could not do unless we were a nonprofit. It's allowed us to have the luxury of time. I love my primary care doctor. I think he's very good, but I'm not sure what he looks like because he's turned around on a computer. I don't think I've ever seen his face, but he's typing back there and he's got maybe 15 minutes. That's right. We don't need that. 15 minutes with me. And I feel rushed. And here I am, a doctor, and you think he would at least try harder, but not the fact. But at any degree, I just wanted to take this time to reassure everyone that we've put together a very good team. I'm hoping we're both in this for the long haul. I'm counting on you.
Yeah.
All right. You said it. You're not going anywhere. And so you all know, I know we're all aging. I'm 67 and I'm thinking about the future. My wife and I are planning, sort of where will our kids be when we have grandchildren and so forth. And I think that's all on our mind as we get older. And our mission is that we all age as healthy and as safely and as happily as possible. I'll tell you what I've learned in this practice, William, is you can go to school all your life. You learn so much here from our patients and our families. And when I came, neurologists don't have specific training in memory disorders unless they do a fellowship after their residency training. So you hope that they have some exposure, but it can vary from doctor to doctor. And we truly believe that the care of memory disorders should be in a specialty clinic. I think that's where it's best managed. And we've had discussions about future educational opportunities. We're going to give a discussion that Cody's going to help us with on supplements, that wild west world of supplements. And is there something we should take and why or shouldn't? And who regulates this? And how do you make any sense of this? And they're expensive. And do they interact with drugs? And is there any research? And then speaking of research, we hope that in the future, our practice will also be able to offer research studies for memory disorders. And that's been on our radar for a long time. And if we do it, we want to do it right. So I think we have a bright future together.
Yes, definitely.
And I was wondering, Cody, did any other questions come in? I think maybe we could.
Yeah, I mean, I can ask two that came in. So these are more generic questions, but the first one is, can you share one thing you'd like patients and families to know about you as a provider, just in general?
Sure. So I will use an example to answer that. So when I was growing up, I was probably in my early 20s, maybe. My grandfather developed Alzheimer's disease. And that's really kind of where I learned what being a caregiver was all about. So he was living with my grandmother, and we knew that he did not want to go into a nursing home. So we all banded together and kind of took shifts on making sure that, as he progressed, that he was safe. But as many folks know, patients will get to a point in that disorder where no matter how much the family does, it's not enough. And because it becomes unsafe for the patient. And the family, their health is also important. So being able to, so we had to have my grandfather go to a nursing home, but we would go there every day and see him and make sure that he was being taken care of. Like I was still like shaving him and, giving him bedside bath and that kind of thing when he was in the nursing home. He was only there for about 6 months before he passed away. But so that's, as far as me as a provider, the most important thing for me is just like I've said before, I'm probably kind of repeating myself, but I know what it's like to be a caregiver. My grandfather and my father recently, I know how important it is to be listened to be taken seriously, to not be rushed. So my kind of format of being a caregiver is just providing time and space for the family and the patient to open up and tell me everything, any questions, concerns that they have, and then I can provide them with the help that the resources we have here at Memory and Movement. So that's kind of the gist of me as a provider.
Okay, great. Thank you. And the second question was, outside of medicine, what are some of your hobbies?
So outside of work, so I'm pretty introverted. So outside of work, I enjoy spending time with my wife and other family. But I also I do have an interest in kind of old classic cars. So I have a '66 Chevelle that I've been working on. And I have a friend who's helped me because I've never done this before. So, and I went to the CPCC actually has an enthusiast program where you can, if you have a car that you want to work on, you can take it there. And they have folks that work there who that's all they do is body work on cars and even modifications on cars. So I took my car there for probably 3 or 4 years working on it and did a lot of work on it, replaced floors and made some adjustments to the frame so we could put bigger tires under those, all this kind of stuff. But so that's my main hobby. I don't have the car right now. My friend's helping me kind of finish that part of things. But when I have it at home, then I just kind of do things that I can do and just enjoy driving it. I just enjoy the craftsmanship of the older vehicles, and my dad kind of got me onto that when I was young. I mean, that was his hobby as well. So it brings back good memories of him. So this is something I enjoy doing.
So when you're not working on the complexity of humans, you're working on the complexities of cars.
Yeah. Yeah.
Great.
Yeah.
Did you have something to say, Dr. Tom?
Well, I'm sort of a Yankee-ish person, not real Yankee, but when I came down here, I was impressed by the NASCAR fans. Are you a NASCAR fan? Do you?
I don't follow NASCAR. I was more of like the NHRA drag racing.
Oh,
yeah.
That sounds even more real.
Yeah. That was some of the things that my dad did. So I grew up in Florida, so we would go to the drag strip and sometimes even race our own, just kind of daily drivers. But we enjoyed just kind of watching the others, who had nicer cars than we did, and were much more expensive than ours. But that was something that we did, and brings back good memories. And so that's my main hobby.
Yeah. Well, thanks for sharing all of that with us. And if this would be the time, if anybody online or in person has any questions, you're more than welcome to come off mute or throw it in the chat. So I'll just be quiet. And if you have a question, come off mute and say something.
While somebody's thinking about asking. When my son was little, he came up to me and said, "Dad, you know why they call it NASCAR?" And I'm like, "Why?" He said, "Because there was a little boy watching and he stood up and he said, 'Hey, that's a nice car.'"
It wouldn't be a Dr. Chaconas show without a joke.
Right.
So good job.
He was adorable. Then he had to grow up. So my son he's still adorable.
There you go. Well, if no one has any questions, thank you guys so much for coming in and sharing a little bit about your story, William, and also for Dr. Chaconas with your flexibility in terms of stepping in. And what you guys don't see behind the scenes is we see this duo running down the halls, chatting it up. So the fact that William just said that you're introverted really shocks me, because you guys are going and laughing and cracking jokes and everything going down the hallway. So I know that they're going to be I know William's going to be a great addition to the Chaconas workforce that happens here. So thank you from my heart. Thank you guys. I know from our patient and families' hearts, thank you guys so much for the work that you guys do. And we're looking forward to it. So once again, I think Dr. Chaconas gave you a little sneak peek into what our Take Charge Live next month is going to be. So it's going to be around memory supplements. So stay tuned for that flyer to come come out in the coming days once we finalize a fun name to put on the flyer. But it will also be hosted by Dr. Chaconas and William with their specialty and supplements. So be looking forward to that. But with that, thank you guys so much again, and we'll see you next month. Goodbye.